Hey everybody, Gray Stahlman. Welcome once again. It's Friday. It's the Doctors In live with TOA. Sorry for the delay. We have had a technical problem. We may have a virus. I don't know. Anyway, as you can see, we've got me and my friend Kevin here, but we don't have a human guest. We had originally thought we'd talk with Dr. Rob Greenberg, one of our associates, but in light of what's been going on around the world, I thought it would be best if we talked a little bit about coronavirus, COVID-19, what we know, and how TOA is approaching the issue. Okay, so everybody has been impacted in some way, shape, or form across the world with this virus. So we're going to talk a little bit about what is coronavirus, why is it a problem, what recommendations there are to manage it, treat it, and whatnot. And lastly, we'll talk a little bit about what TOA is doing to try to help protect our patients. As with all of our Doctors In episodes, remember that while I am an orthopedic surgeon, I'm currently not your orthopedic surgeon. And so I want you to make sure that any information we talk about today is considered for educational and informational purposes only. I'm not giving you medical advice. If you have questions, talk to your regular doctor or talk to your orthopedic surgeon here at TOA and we'll try to get that taken care of. I also want everybody to know that I am not an expert in epidemiology or infectious diseases. I'm interested in them, but I'm not an expert. So what I'm going to tell you is my opinion and my interpretation of what we understand. But I don't want you to consider my discussion the expert of expert opinions, just so you understand that. So let's get started a little bit about what is the whole big deal about this COVID-19, the coronavirus, and what's going on in the world. So I'm sure a lot of you have heard of a term called novel coronavirus. And what that really means is novel just means this is an organism that has never been seen in humans before. And what that means is we don't have any experience with it. We don't know what it can do, how it acts, what's going to happen into the future. And that's the big unknown. Viruses are common. Coronaviruses in general are common. And in fact, there are a number of viruses, for example, that cause the common cold, rhinovirus. Coronavirus is one of those. Well, this coronavirus that we're dealing with is different. It is thought to be a mutation of a typical type of coronavirus that was likely seen in animals. Viruses can be seen in any kind of living organism. And it's felt that this one mutated from an animal host and became infectious to human beings. And so what basically happened was it's been around for a long time, presumably, but it's not been in the human population until something happened genetically where enough virus particles got changed in the animal that then became infectious to humans. Okay? Let's talk a little bit about what a virus is first so we can kind of understand the bigger picture. So viruses aren't considered by most scientists living organisms. They're particles, they're potentially living organisms, but basically they're very basic genetic entities that require a host, either an animal or a plant, something living or human, to allow it to replicate or reproduce. Living organisms like bacteria can reproduce on their own, but viruses need a living host in order for it to replicate or to reproduce. And so what happens is these, we'll call them particles or organisms, we'll call them organisms. These organisms have to have something to hang on to in order to use that something's genetic machine to keep it alive. And this is important with this coronavirus. It's also important with influenza or flu, the common cold, all these other viruses, because it matters where this organism is found. Coronavirus, the COVID-19, is transmitted primarily through the respiratory tract. And what that means is through your face, your mouth, your nose, your eyes, and sets up shop in those cells in your body and uses your body to help it reproduce and grow. The virus can't live very long outside of a living organism. For example, we talk a lot about in this outbreak of cleaning surfaces, washing your hands, these types of things. They found that this particular coronavirus can last maybe a few days on a hard surface like metal or plastic, maybe even just a few hours on softer surfaces like cardboard. And so part of our containment of the virus is to make sure that we can't take that virus from one place to another. So that's how viruses work. They don't have brains, they just use genetic machines to reproduce. The way this particular virus causes problems, however, is that it attacks your respiratory system, your breathing system. And in those people who've gotten really sick and have ultimately died from this, basically they develop a super bad pneumonia and an inflammatory destruction of their lungs, and they can no longer breathe. They can't pass oxygen from the air to their blood, and their body shuts down. And so it is a very serious problem. The way we are addressing how to deal with this is a on-the-fly kind of decision process. The reason being is we don't know everything about this virus. We've never seen it in humans before. And we don't know how it's going to act. As compared to something like the influenza virus, which comes around every year, the flu, comes around every year, lots of people get sick, many people die from the flu, it tends to go away in the summer months. It comes back in the wet winter months. It can be a different set of viruses that attack people, and it cycles back and forth. The coronavirus, this particular coronavirus, we don't know if it's going to disappear during the summer months. We don't know if it's going to lay dormant in people and come back later in the fall. We don't have the experience, so it's an unknown. This is not the flu, okay? And the reason why it's not the flu, the typical flu, is we know how influenza and the flu typically works in most people. We know its history. We don't know anything about this organism at this point. In addition, the way we understand it, influenza viruses have the ability to provide you with some degree of immunity, which means if you get it, your body learns that that's a bad thing and learns to protect itself from getting infected again. That's why vaccines can be of value. Now I realize that not all flu vaccines cure or prevent all flus, because the reason why is the scientists and the companies are trying to guess what the most likely influenza viruses are going to be prominent in the next year. So they're deciding way ahead of time what they want to attack. Sometimes they make a mistake or don't get it right. Right now, we don't have a vaccine for coronavirus, COVID-19. We also don't know if your body will produce immunity if you get infected. It may produce a mild immunity, which means you can fight off the infection if you get exposed to it again. It may not. It may not last. We are actually hearing reports in China, for example, where people are being reported as showing positive again after they've had the virus and have tested negative. So we're still looking to see if we are going to develop some form of immunity. Saying that, you've got to understand, we don't have a vaccination for this. We don't know how it works. People are working on it. People are working on various medications to try to eradicate this illness. But right now, we don't have a vaccination for this problem. As I said, coronavirus is a family of viruses. This is just a very special one with regard to humans. Why did it start in China? The scientists believe that it came from animals, and it may be associated with the fact that in China there are a lot of open markets with multiple animals in them, and something happened to cause this mutation. But it could have started anywhere, really. The big thing right now that we're dealing with, that we're struggling with, is how do we prevent the same blossoming of the growth of the organism and infections in this country that we've seen in Italy, that we've seen in China and Iran and others. And that's where our leaders, the scientists, are working hard on trying to give us advice. Now it's pretty drastic. Most of us, certainly people younger than me, don't really remember times of quarantine or times of massive changes in our behaviors because of a public health crisis. But it's been going on ever since the United States has been around. Quarantines have been required to try to help prevent the spread of illnesses. In the 50s, and a little bit earlier, was the polio epidemic. In the early 1900s, it was the influenza, the Spanish flu. You may remember more recently hearing about bird flu or swine flu or SARS. These are all viral illnesses that occurred, or Ebola is another one, although it's a completely different mechanism. These are illnesses that popped up around the world, and the way that was best able to control its spread is by blocking it off. So I've done a lot of thinking about kind of what's a good analogy for people to kind of understand why we are shutting down everything, why we are recommending avoidance of large groups or social gatherings or keeping your distance from other people. And I really got to thinking about what is pretty much everybody seen. Well, that's forest fires, okay? When a forest fire occurs, the forest is on fire and the fire goes where the wind blows it. Firefighters try to to contain the forest fire by doing a couple of things. The first thing is throwing water on it, throwing chemicals on the fire to extinguish the fire. That's kind of like a vaccine would be or a medicine would be for humans in a disease. Unfortunately, we don't have that. We don't have a vaccine to keep the forest from burning, nor do we have any kind of medicines to stop the infection from taking hold. Another thing that firefighters use is fire breaks. They'll take a bulldozer and create long swaths of bare dirt, or they'll set fires that are called backfires, where they will burn stuff in front of the fire. The points of those is to take away the future fuel for the fire. So the fire burns up to that point, it can't burn anything else, and so it burns itself out. That's really what we're trying to accomplish by keeping everybody away from one another. We're essentially trying to decrease the quickness of the spread of the disease. Now, why is that important? We're probably going to help a few people not get infected. But more importantly, what we're doing with that type of behavior is as you've probably heard on the news, do what's called flattening the curve. What we don't want to see is a gigantic, huge spike of cases that present all at one time that then overload the healthcare system. We won't have any hospital beds, we won't have any ventilators, we won't have any supplies to take care of the people because they all hit the door at the same time. What we're trying to do with separation, social distancing, restricting out activities in groups and whatnot, is to make it so that fewer people get infected all at the same time. We may still have the same number of infections, but we're trying to spread that out over a longer period of time so that we don't overload the healthcare system. For you that are old enough, there was an old commercial, Heather Locklear did it. It was a shampoo commercial, and it was, I think it was Fabergé Organics, something like that. Anyway, there was a commercial where she said, I used this and I told 2 friends and they told 2 friends and so on and so on and so on. That's how the spread of this works. If there's one person that's infected and they come in contact with 5 people and infect them, and each of those people comes in contact with 5 people and infects them, it's an exponential growth of the disease. And so think of it, 10 times 10 is 100, 10 times 10 times 10 is 1,000, 10 times 10 times 10 times 10 is 10,000. You can see how the number grows hugely in a relatively short period of time. That's what we're trying to do. Our fire breaks, our backburns, are try to keep that growth from growing that quickly. Who are the people at risk for this disorder? Everybody is, okay? Young people, old people, infants, any human being can potentially get infected with this virus. What's been seen is, at least for now, the people who've gotten the sickest, or the majority of people who have died, have tended to be older or people with medical problems. However, there are deaths in children, there are deaths in young adults, and there are deaths in middle-aged people as well. So it's just because you're 20 years old doesn't mean you can't get sick or can't die. In fact, I read a story yesterday about a fella 35, went on a business trip to Florida, took a little side trip, I think, to Disney World or something like that, and he had asthma, but soon thereafter contracted the illness and died. He was 35. So don't think that just because you're young you can't get it. The young people also have to remember that not everybody gets super sick. Some people have very few symptoms, if any. Some people have terrible symptoms. The trouble is, people can be infectious, people can give it to other people when they don't have any symptoms at all. And that gets really scary, because if I didn't have any symptoms and I went to a party with a bunch of my friends, but I was actually infected, I could give it to all my friends and I wouldn't even know it. So that's why it's really important for people to not be cavalier or not be egocentric about, well, I'm not sick, I can't get it, it's no problem. It actually is a problem, because you can harm other people. It just so happens that the younger people may not get as sick as others, okay? You can still infect other people, however. So what are the symptoms that we start to worry about? Fever, dry cough, aching joints and muscles. Those are the most commonly seen things to some degree or another. The people who are getting really sick start having more problems with their breathing, shortness of breath, difficulties with oxygen exchange in their lungs. Their lungs fail, their heart fails, or other organs fail. What do we recommend? So if you think you've been exposed, if you have some of these symptoms, you're pretty healthy, not older than 60, not many medical problems, you have a little fever, some cough and whatnot, first off, stay home. Second off, call your doctor. Don't go into the doctor's office and potentially expose all the people in the doctor's office with a possible illness that you can pass on to others. Call your doctor and get some advice. Most of the time, the advice will be stay home. The majority of people are treated with simple things like rest, fluids, and time. The people who are having more trouble, shortness of breath, higher fever, getting worse, they need to talk to their doctor, but those are the people that should probably end up going to the hospital for an evaluation. Now, should everybody get a test? In the ideal world, yes. And the reason why is if everybody were tested, we'd know how many cases of this problem are out there. As I said before, a lot of people have very few symptoms, if any, but they are still infectious. So it would be great to be able to know every single person in the world, are they positive or negative? That would really give us good numbers. That's completely unrealistic for a couple of reasons. Number one, it's impossible to test that many people, billions of people. Number two, we don't have the tests available. Now, that's not really a fault of anybody, okay? This came on rapidly in China. Iran, Italy were the top three earlier areas that were showing infections. But this progressed rapidly. It took a while to develop the machinery to produce the tests and produce tests that were accurate and approvable. The good news is that machine is really starting to work. So testing is coming out and more and more and more people will be tested. In Middle Tennessee, I heard a statistic that about 1,000 people per day or more have been tested by Vanderbilt alone. So it's out there, it's getting more and more available. But frankly, even if you're positive, if you're having mild symptoms, there's not going to be any real treatment for you. So it's really taking responsibility for yourself and saying, I could be sick. It's possible I have this. I'm not dying yet. I should keep away from other people so I don't give it to other people. I actually read a little article a few days ago, it was first of the week, from a fellow in the UK, and his point was, we should really not think about this like I'm doing everything I can to avoid getting the disease. What we should think about it is as I've already got the disease. What can I do to prevent other people from getting it? That's really a better way of looking at it because it is a self-responsibility problem. It's on all of us to protect ourselves and our family and loved ones, but it's also our responsibility to protect those outside of our family, our coworkers, people just randomly on the street, particularly those who are at risk. So people who have cancer, people who are under chemotherapy, people who have immune system problems, people who are older, and people who are sicker, okay? So really, it's important for people to think, it's not me, it's us. We're all in it together, and we need to protect each other from ourselves, okay? What's going to happen with this? We don't know. It's going to blossom and grow. We're going to see more and more cases because we're doing more and more testing. We're going to see more patients die. It's going to happen. This is still kind of the tip of the iceberg. I'm looking up an application here. This is, as of 15 minutes ago, the statistics worldwide. Okay? In Tennessee, we went from about 30 cases at the beginning of the week to 150 or so cases today. It's going to get bigger. Okay? The red is how many cases, the gray is total deaths. This is going to change. This is an evolution. If you're interested in following, this is a great website put out by Johns Hopkins. And if you look up systems.jhu.edu, it'll take you to this data collection site. And this is real-time data from across the world that they're accumulating and putting into a graphical picture. It's worth looking into. So systems.jhu.edu. So what are we doing about it at TOA? You know, we have a responsibility to take care of ourselves, but more importantly, take care of our patients. We have a lot of older people in our practice, being an orthopedic practice. And so we have tried to be on the forefront in the community about committing to minimizing the chance that we could cause problems for our patients. And so earlier this week, we came to an agreement within the group that we were going to significantly limit the number of patients coming into the office to just those people who have urgent or emergent problems. We were going to significantly limit the number of surgical cases that we did to those that are urgent or emergent problems. Somebody with arthritis of their knee, they've had pain in their knee for 5 years. Yes, it hurts, and we'll get to you, but that's not a priority right now, okay? This actually followed and predated many of the recommendations of the hospitals locally about limiting access. St. Thomas Health, for example, relied heavily on TOA to make their protocols, and now they are restricting cases, surgical cases, to those people who are urgent or emergent problems. Why do we do that? Well, there's kind of 2 or 3 reasons. The first is being in the hospital can be a dangerous place. Sick people are in the hospital, and if we bring somebody who's not sick but has an orthopedic problem into the hospital, they could get infected in the hospital. Secondly, it's in preparation for the possibility, or more likely probability, that we're going to have a substantial strain on our healthcare system. If we have a hospital filled with elective surgery patients, we don't have any beds available for those people who become critically ill with this disorder. And so we're essentially preempting an overload by making sure the hospital has room for patients who really need it. The third thing that limiting our cases does is helps to preserve the supplies that are needed to take care of these people. Masks, gloves, gowns, medicines, these types of things that in the normal day pretty much are unlimited because we never get to the extreme of using them all up. But in this day, we could easily find ourselves stretched to the limit of these limited resources. And unfortunately, because many of these products come from places like China, who are not shipping a bunch of things out, we can't get them right away. And so we're trying to help minimize the excess use of these materials for non-urgent or emergent problems. I think in the next few days, if not maybe this afternoon, we're actually going to see state and more likely federal regulations stating that there will be no elective surgeries allowed during this period. Only emergency problems or urgent problems that could pose harm to people if they didn't have surgery will be allowed. The governor, Bill Lee, has made this recommendation to the legislature. I think it's gone up to the White House and the federal government, and all 50 governors have recommended this to the federal government. So I wouldn't be surprised if we don't hear something today or maybe first of next week or sometime in between that no elective surgical cases will be allowed. Again, this is not to punish people, it's not to harm people, it's to preserve the system as best we can so we can serve as many people as we can. We're going to get a lot of cases. There's been estimates in the United States that there may be up to 38 million people infected with COVID-19 at some point. That may be no symptoms, that may be somebody who ultimately dies from it. 38 million is 10% of our population. That's a lot of people. We don't have 38 million hospital beds. Say only 10% of 38 million need hospitalization or ventilators. We don't have 3.8 million ventilators. We don't have 3.8 million empty beds and physicians and nurses and all the other people to take care of those people. So what we have to do is utilize our resources gradually rather than having everybody hit the door all at once, like I talked about before, and overstressing the system. That's why we're having to make sacrifices. That's why we are avoiding trying to transmit that virus to another person who can then transmit it to another, and so on and so on and so on. So that's really where we are. This is going to be a dynamic situation. The rules of the game today will be different tomorrow, will be different next week. And the reason being is we don't know how this is going to play out. This could seriously be a problem that lingers not for a few months like the normal flu does, but for all year or longer. We don't know. So please be smart. Listen to the advice of the Centers for Disease Control, the CDC. Listen to the advice of your physicians. Don't rely on social media, non-verified sources for your information. Be kind to one another. Use common sense. There is no need for hoarding or gathering up toilet paper so that somebody else doesn't have any. The supplies are still coming in, but there's no reason to do that. There's no reason to panic. But it's important that we have to think not just of ourselves, but everybody, because this is a global problem. It's not just a my problem or my friend's problem or my neighborhood's problem or my city's problem or my state's problem or my country's problem. It's a global problem. And I'm hopeful that we can look back on this years from now and say, gee whiz, that was 2020's Y2K, where nothing really big happened. I'm not sure it's going to happen that way, and we can't count on it being that way. So please, listen to the advice, be smart, don't be selfish, don't expose yourself to other people, call your doctor if you feel sick, be patient, be kind to one another. Okay? If anybody has any questions, any advice, please feel free to comment below. Come to our Facebook page, TOA.com, and I'll try to share as much information as I can with people. This is a complex topic. It's scary. There's a huge amount of unknown. But there are way, way, way more smarter people than me out there working on getting this fixed. Let's stay away from the partisanism. Let's stay away from selfishness. And let's combat this together. Because we can, and we will. But please, be patient. Okay? Next week, we did not have anything planned because I was supposed to be out of town for our Facebook Live. And we're going to try to come up with something. We may come back to this. We may do another topic. But again, noon, Friday, Central Time. I'll be there. Hopefully our technology is back up. I think we may have a virus. I don't know. Wash your hands. Keep your hands off your face, nose, and eyes. Stay away from people. Take care of yourself and your family. Be kind to each other. Go out there and live your best life.